And if we set aside 2% of our budget, then we're allowed to spend 98% of our budget by statute. So we set aside money several years ago, about $400 million, but because of budget cuts over the last 2.5 years, we have been taking money out of that rainy day fund. I'm not sure what the current balance is. I think it's down around $100 million now. And we are, in this current budget, we're going to be cutting agencies further. The governor, in his most recent budget cuts, spared MAEP, which is the Mississippi Adequate Education Program. That is our K through 12 education funding formula. And he spared student loans, which are loans that we provide our students who stay in Mississippi universities and junior colleges. And there was something else, someone may remind me, there was something else that was spared, but essentially, I'm sorry? Law enforcement, thank you. And he's asking for a trooper school. But those are cuts that are made to this year's budget, to the current budget, not to the budget that we're putting together now for next year. As a consequence of tax cuts that the legislature has passed over the last 4 to 5 years, we're going to have a negative impact on revenue that we're seeing this year of $291 million. So that's $291 million less in revenue than we would have had otherwise. Next year, the tax cuts that you probably heard about that were passed last year kick in. And that begins a slide of a loss of about $415 million in revenue. You add those numbers together, over the next few years, we're looking at a loss of revenue of approximately $700 million. Our budget, folks, is only about $6 billion. So those of you who are mathematicians can do the math and figure out what percentage that is, but we're losing, or we stand to lose, a considerable amount of our revenue that we need to put together a budget. What does that do? Well, we've all heard discussions about what it's done to our departments of health around the state, and specifically what it's done to mental health. They've had to close mental health beds at Whitfield, which is our state hospital. They've had to lay off people in the mental health field in Mississippi. And this is a time where those of you who know what we did here in Hancock County for the last 2 years and looking at the Department of Human Services and children in custody of DHS, now CPS, and our foster care system, one of the findings that we made here locally was that we need more mental health services for folks who are struggling because of the economy, because of Katrina, because of BP, because of the number of things that have hit us here in Hancock County and South Mississippi. So, for some of us, we think we ought to be putting more money towards mental health and those types of services we provide in our communities, and instead we're cutting those back because we just don't have any choice due to budget constraints. You may have also heard that the Department of Medicaid, or Division of Medicaid, came to the legislature for a budget hearing and requested an additional $75 million. This is not $75 million more that they need for next year. This is not, they don't want an increase in their budget of $75 million. This is $75 million that they were not provided in the current budget year. It is a deficit appropriation that they are requesting so that they can make ends meet in the Medicaid program. So, in terms of setting the stage for where we are, those are the not so happy numbers that we have to talk about. And while we're on Medicaid, let me talk for just a second about that, because I think it's important to understand what who our Medicaid program in Mississippi serves. A lot of people, myself included, when I was elected in 2007, I didn't really know anything about Medicaid. No one in my family that I knew of had ever been on Medicaid, and I presumed that Medicaid was a giveaway program for the poor who didn't have jobs, couldn't afford health insurance, and needed to show up at an emergency room or somewhere else to save their lives or to save the lives of their family, and that's what Medicaid was for. The Medicaid numbers show a different picture. So bear with me one second. In terms of Medicaid recipients in Mississippi, 56% are children, 23% are disabled, 9% are senior citizens, 7% are low-income parents. I don't think those numbers total to 100, and I don't know what the other percentage is, but it's probably a smattering of 5 or 6 or 7 other categories. But I want people to understand that when we talk about the Medicaid population and who is served by Medicaid, we're not talking about just freeloaders. And so when under the Affordable Care Act, we talked about Medicaid expansion, we were not talking about giving more money away to the poor, to the freeloaders, to the people who don't work in our society, but we were talking about ensuring a population that we call the working poor. These are single moms that work sometimes 2 jobs, but can't make ends meet and can't afford health care, aren't provided health care through their employers. And so this is a population that was going to have some basic health care through expansion and have a payment mechanism. Let me talk about why that's important for just a minute. And I'm doing all the talking here, but if somebody has a question, please throw up your hand and we'll stop anywhere along the way to talk about that. The ACA, which, as we all know, now Congress is moving to repeal. We don't know what they're going to replace it with or if they'll replace it, but they certainly are moving to repeal the ACA. Let's talk for just a second about what the ACA was intended to do. First of all, I mentioned the payment mechanism. For years and years and years, we had a system where those of us who had insurance paid higher rates for medical care to subsidize those who couldn't afford. In other words, we paid 10 times as much for a sponge as that sponge was actually worth, because there were people who were getting sponges for free. So we had to offset those costs. And that's one of the things that the ACA was intended to alleviate, one of the problems that the ACA was intended to alleviate. So how was it going to do that? First of all, everybody was going to have a payment mechanism. Before the ACA, if a person who didn't have any health care insurance or any money to pay for health care went to the hospital, they were going to have medical care provided to them, because that's what the hospital has to do under our system. So how does the hospital take care of that budget hole that is created by taking care of thousands of patients and providing millions of dollars of health care to the poor? Well, we had been doing that through what's called DSH payments, disproportionate share, which is a federal subsidy which is paid to hospitals to compensate them for the care they provided to people who don't have insurance and aren't on Medicaid. So that under the ACA, the DSH subsidy would go away. Everyone has a basic level of health care coverage. Insureds no longer pay for uninsureds. The idea would be that cost would then thereby be lowered, and we would end the exclusion that insurance companies had in every healthcare policy for pre-existing conditions. The ACA would allow your children to stay on your policy, I think, to age 25 or 26, whereas they were being kicked off at 18 or 21 when they reached the age of majority. And of course, the subsidies for DSH would go away. All of that was contingent upon the healthcare exchanges being set up and folks being able to get insurance in those exchanges and Medicaid expansion. As you guys know, the ACA was challenged in court, and the United States Supreme Court considered that case and determined that particularly the individual mandate provision that most people had problems with, myself included, because I'm one of these people that don't think the government ought to force us to buy anything, including car insurance for that matter. But I said, no way the Supreme Court is going to uphold the individual mandate, but they did. But they said that states could opt out of the Medicaid expansion provision. So what did that do? For a state like Mississippi, our governor said, we don't want Medicaid expansion. We don't like the Medicaid program generally, and we don't trust the federal government to make good on their promise to continue to fund 100% and then dropping to 90% of the cost of Medicaid. So we didn't do it in Mississippi. All those 300,000 working poor did not get Medicaid coverage, so they didn't have a payor when they went to get some medical care. So it created that problem. But the other problem is when DSH goes away, remember that's the supplement to the hospital like Gulfport Memorial and Hancock for taking care of the poor, then there's a budget hole in that hospital's budget. That has been terribly detrimental to local Mississippi hospitals, including our own here in Hancock County and elsewhere around the state. That is why you saw hospitals, even though doctors aren't liberals, they're largely conservative and largely Republican, they were for Medicaid expansion. because that's the only way the whole program would work. That's the only way hospitals could be made whole, and that's how they could stay open. And we all want our local hospital to stay open. It's usually the largest employer in any community, and we're no different in Hancock County. I think that hospital is the largest employer in our county, and excuse me, we certainly don't want to see it closed. So that's the backdrop to the ACA, Obamacare. That's what is likely going away, but because we refuse to expand Medicaid, our Medicaid program did not receive the $15 billion that was estimated would flow into Mississippi through the ACA, and that's why, one of the reasons why our Medicaid program is currently suffering a $75 million deficit. And remember this also, folks, Mississippi is one of the largest benefactors of federal government largesse in the entire country. Whether you like it or not, we get more tax dollars back than we pay in. California, New York, they would love to see Mississippi secede because their money, when they pay it to Washington, gets sent down here. Mississippi pays $1 for the Medicaid program and gets $6 back. That's a pretty good investment. But we decided against that. And so now we have a huge problem with the Medicaid budget. I don't know where we're going to come up with $75 million. Yes, ma'am. And I'll stop there and answer a question.
So for an individual working poor person, when they call to get their insurance under the ACA, how is this Medicaid decision by our governor impact their ability to have insurance?
Okay, and for those of you who didn't hear the question, I'll try to rephrase it. Tell me if I get it right. For the individual who's trying to get their